This is the continuation of our kidney transplant video here at my YouTube channel, MELDITA'S Info Corner. And my Facebook is johnregacho@yahoo.ca. Okay, going back to the question, why does donor kidney fail to work effectively or fail to work completely? Number 3, donor kidney dehydration. Well, dehydration can lead to kidney damage. Prior to discharge, the transplant doctor will speak to the patient about drinking lots of fluids, and that be like 2 to 2.5 liters a day or 8 to 10 glasses of water per day. There are drinks that interest me that patients should avoid, and these drinks will make the patient pee or urinate fast and lots, and that can lead to the dehydration of the donor kidney. An example of that is alcohol, coffee, and some other drugs, or maybe some other drinks that I don't know yet. Okay, I also place here chronic allograft nephropathy. I did some readings on several, references about this one, but I did not expound further. But just interest me, I just put it here. Okay, this is chronic allograft nephropathy, which says there's a chronic interstitial fibrosis and tubular atrophy. This will lead to progressive gradual decline in kidney function. Okay, allograft, because we have here a kidney transplant patient. When you say allograft, that tissue or organ comes from one person to a patient. Okay, so chronic allograft nephropathy, chronic interstitial fibrosis, and tubular atrophy that leads to progressive gradual decline in kidney function. So I'm not going to elaborate this, but just for your information, and it's interesting as well. Okay, comorbidities. In comorbidities, some patients are diabetic. They have diabetes mellitus, hypertension, high cholesterol. Okay, our aim here is to see that the patient's blood sugar is under control, the blood pressure is under control, and the LDL is under control. So we don't want high blood sugar, so be sure they take their medication for their diabetes. We don't want high blood pressure, be sure that they take their blood pressure pills. And, this anti-cholesterol medication, be sure that their LDL is okay. Because high blood sugar, high blood pressure, and high cholesterol, and also quitting smoking. So all these chemicals will affect the artery of the patients, that artery that leads to the kidneys. So be sure that we don't want to aggravate or do some damage more on the arteries, because that will affect the flow to the kidneys. Be sure that the patient quits smoking if he smokes. Try to lose weight for overweight or obese patient. Exercise and avoid stress, and be sure that the nutrition is healthy and high in fiber. Okay? So that's about it, and thank you so much. And our very last video will be cytotoxic precaution. Okay, thank you so much.